Good afternoon. Could you tell us your name, please?
Kelly Marie Mills.
And doctor, how are you employed?
I am employed at the Ramsey County Medical Examiner Center in St. Paul, Minnesota.
And in what capacity are you employed there?
I'm the principal assistant medical examiner.
What is a principal assistant medical examiner?
Well, a medical examiner is someone who gets involved when someone dies and helps investigate the case to some degrees, but they're looking for cause and manner of death. The principal just means I'm the second lead at the office.
All right. And how long have you been employed at the Ramsey County Medical Examiner's Office?
17 years.
Right. And let's talk a little bit. Actually, first off, were you employed there in March of 2018?
Yes, I was.
Now let's talk a little bit about your educational background. Can you describe for the jury, please, your post-high school educational background?
I earned my Bachelor's of Science degree in Biomedical Sciences at Grand Valley State University. I went on to earn my medical degree at Wayne State University. I then went on and did an anatomic pathology fellowship at the Detroit Medical Center. And then I did my forensic pathology fellowship at the Wayne County Medical Examiner's Office in Detroit.
And as part of that, do you also do a residency?
The residency was at the Detroit Medical Center, yes.
And doctor, do you have any board certifications?
Yes, I do.
And what board certification? First off, what is a board certification?
A board certification is after you've completed all of your training. Residency was one of them. You'd sit for a nationwide test, and that gauges whether you pass or don't pass. I'm certified in anatomic pathology. And then after my fellowship, that's again a nationwide test, I took another certification exam, and I am board certified in forensic pathology.
Sorry, they're already marked. Never mind. May I approach, Your Honor? Mr. Mills, I have handed you what has been marked for identification as Exhibit Number 2. Can you tell me what Exhibit Number 2 is?
It's my CV,
And what is a CV?
a curriculum vitae or resume.
All right. And this goes through your educational background, as well as publications that you've been involved in, research and teaching experience, awards, those types of things.
Yes, it does.
Also discusses the organizations that you are a member of.
Yes.
What organizations are you currently a member of?
The National Association of Medical Examiners, or NAME, the International Association of Coroners and Medical Examiners, and here and there, sometimes the Minnesota Medical Association.
All right. Your Honor, I'd move the admission of Exhibit 2 at this point.
Any objection? All right, Exhibit 2 will be received.
All right. And doctor, how long have you been board certified in forensic pathology? Approximately.
16 years.
All right. And that then brings me to the question, what is forensic pathology?
Forensic pathology is looking at injuries and trauma as they pertain to death, so you can conclude at a cause and manner of death.
And when you talk about cause and manner of death, what is cause of death?
Cause of death is the actual process of death. So if I gripped my chest and had a heart attack right here and now, that would be a myocardial infarction. That's the cause of death.
And what is manner of death?
A manner of death is the circumstances surrounding death. We've got 5. There's natural, suicide, accident, homicide, and undetermined, meaning you can't actually pull one of the triggers on one of the 2, so you're trapped between 2 or 3.
Okay. And doctor, when you are trying to determine the cause and the manner of an individual's death, what's the procedure that you go through in trying to determine cause and manner of death?
You perform an autopsy.
And is there a particular manner in which you generally perform autopsies?
Yes.
Can you describe that briefly for the jury?
First, you start with the external examination, which is looking at an individual and how you describe that to another person. So age, race, gender, sex, hair color, eye color, if there's tattoos, if there's scars, if there's any missing body parts or amputations, and looking for trauma as well. That's the external exam. Then you move on to the internal exam, which is the internal part of the autopsy. And now you look systematically at all the internal organs, looking for natural disease as well as trauma. Throughout that process, we collect bodily fluids like blood, urine, bile, vitreous fluid from the eyes, and you collect those and save those in case you want to test for drug tests. You can also do electrolyte panels too to give you your sodium and chloride, so forth. Throughout that process, we take portions of the tissue and save those for a period of time in formalin to preserve them. After that is all done, then we are now done with our autopsy, and we have a reasonable degree of going forward for a cause of death as well as a manner.
Right. Do you also document the clothing, or if there is no clothing, the lack of clothing on the individual when they come in for the autopsy?
Yes.
Right. And during the procedures of the autopsy, do you photograph the various items, both the body and then any clothing that that individual may be wearing?
Yes, we do.
I've already provided a copy of these to counsel. Doctor, I've handed you a manila folder that has a series of photographs in them. I want you to take a look at them. They're numbered not sequentially, but we'll discuss the number when we talk about them. And then I just want to ask you a question about them all once you've had a chance to look at them. Doctor, have you had a chance to look at all of the photographs that are contained in that manila folder?
Yes, I have.
All right. And are those all photos that were taken as part of the autopsy procedure? Actually, let me back up a second. In March of 2018, were you asked to perform an autopsy on a body that was identified to you as belonging to Alexander or Alex Woodworth?
Yes, I did.
All right. And did you perform that autopsy?
Yes, I did.
And did you follow the general procedures that we talked about previously?
Yes, I did.
We'll talk about some of the specifics of that. As part of that procedure, do you document by photograph the parts of the autopsy as well as the clothing and the body of the individual?
Yes.
All right. And do all of the photos that are contained in that manila envelope or folder that I gave you, are those all accurate representations of the various items of clothing contained in those photographs?
Yes.
Your Honor, I'd move the admission of exhibits, and I'll list the numbers right now. They're exhibits 6, 9, 14, 16, 18, 22, 25, 27, 28, 31, 35, 38, 40, 46, 48, 52, 53, and 56.
Okay. Okay. Exhibits just listed by Mr. Dufour. You have those, Madam Clerk? Those will be received, ladies and gentlemen.
And I would ask to be able to publish, Your Honor, in my method that I intend to do, as opposed to putting the photos on the Elmo. I have them on my computer. If we can switch to that, I have them in the same order that I just listed them, and I will ask Dr. Mills about each photo as we publish it to the jury.
All right, and you have, you're going to indicate which exhibit it is? That
Yes, I will.
Okay.
We're going to, yes, if we can switch to there. What we have up there is Exhibit 6. Can you tell us what we're seeing there, Dr. Mills?
We're looking at the front aspect of the pants Mr. Woodworth were wearing. There's a brown belt, and you can see the tan jeans with abundant blood, and then there's tearing at the cuffs at the bottom.
All right. Dr. Mills, when you examined these pants, did you observe any obvious mud on the pants?
No, I did not.
Let's move to Exhibit 9. What are we looking at here?
These are the bottom of the socks that Mr. Woodworth were wearing that I removed from his body.
Did he have shoes on when he came in for autopsy?
No, he did not.
All right. And as far as the socks, did you observe any obvious mud on the socks that Mr. Woodworth was wearing?
No, I did not.
Exhibit number 14, what are we looking at here?
This is the front of the underwear that Mr. Woodworth was wearing, and you can see abundant blood.
All right. And exhibit number 16, what are we seeing here?
This is the front of the band of the underwear that Mr. Woodworth was wearing, and there's a linear defect there in the band.
All right. A hole.
Correct.
All right. In your terminology, you generally refer to something like that as a defect?
That is correct.
All right. And we're going to talk a little bit more about that and the location of that in a little while. Exhibit number 18, what are we seeing here?
This is again the front of the underwear that Mr. Woodworth was wearing. It's in the crotch region, and you can see with a little difficulty, just below that gray scale, another defect.
All right. And Doctor, I'm going to give you, if I may approach, Your Honor.
You may.
This has got a laser pointer on it, which would be the red button. Can you use that to try and show us that area?
The defect is right here in the middle. You can see it's a little bit of crease, but there's the edge of the defect here.
All right, great, thank you. Moving to Exhibit 22, what is this?
This is the front of the sweater that Mr. Woodworth was wearing. And again, you can see abundant blood.
All right, and can you just kind of outline for us a little bit where the you talked about abundant blood, where were you seeing blood on there?
The sweater, the original color of the sweater is this grayish color here. Anything from this line that I'm drawing over to the right of the screen, that's all blood soaked. There's blood here along the base of the sweater, as well as on the left armpit, arm, and torso region, and the cuff of the left sleeve.
All right. Moving on to Exhibit number 25, what are we seeing here?
This is the neck hem of the front of the sweater that Mr. Woodworth was wearing. And what I'm trying to show here is that there aren't any defects, so it's completely intact.
Okay. So nothing went through the sweater at that area?
That would be correct.
All right. Moving on to Exhibit 27, what are we seeing here?
We are looking at the lower portion of the sweater, and it's just showing more of the blood
Okay.
and no defects.
All right. Taking a look at Exhibit 28, what are we looking at here?
This is the bottom of the sweater and showing a little bit of blood at the base, but then you can start seeing a defect here on the left lateral region of the sweater.
And Exhibit number 31.
This is the back of the sweater that Mr. Woodworth was wearing, and again, it has blood that you can see, the red-brown discoloration, and you can see a defect at the back of the right shoulder that the pointer's pointing at right now, as well as a defect here on the right side of the back of the sweater, and then another defect on the left. It's more lateral, but the way I have it laid out, it looks like it's on the back.
All right. And looking at Exhibit number 35, what are we seeing here?
This is again the back of the sweater that Mr. Woodworth was wearing, and it's got a gray scare that I placed there underneath one of the defects on the right back. And then again, you can see the defect at the back of the right shoulder.
Okay. Moving on to Exhibit number 38, what are we seeing here?
This is now showing the left side of the back of the sweater, and you can now see two defects on that region of the sweater as well.
All right. And that would correspond to what area on Alex's body when the sweater is being worn?
The left lateral torso.
Okay. And lateral torso is what?
It's lateral is side, and torso is your thorax.
Okay. And what are we seeing here in Exhibit number 40?
This is showing the three defects that are located on the left lateral region or back of this sweater. So you've got 1, 2, and then 3 defects.
Okay. And that's on the left side of the sweater.
That is correct, yes.
And what are we looking at in exhibit number 46?
This is the front of the right pant of Mr. Woodworth. It's on the upper region that would correspond to the thigh. And you can see a linear defect here in the central region of the photo.
And looking at exhibit 48, what are we seeing here?
This is a close-up of the front region of the crotch portion of the pants, and you can see another defect.
Right. And exhibit number 52, what are we seeing here?
This is the front of the waistband of the jeans, as well as the belt that are located there. You can see the button that latches the jeans, and I'm showing the absence of a defect.
Okay. And right underneath the buckle there, we see that kind of glossy red, brown color. What is that?
That is dried blood.
And is that kind of pooled in that area?
Yes, it's congealed, and it would flake off if you tried to remove it.
And how about if we look on the other side, also underneath the belt, is that some more congealed blood there? On the,
Right
Right
here,
there.
yes.
okay,
A little bit there as well.
all right, thank you. And then exhibit number 53, what are we seeing here?
This is the front left portion of the waistband that Mr. Woodward was wearing on his jeans, and you can see more of the congealed blood along the seam. And again, a lack of a defect.
All right. And then what are we seeing here in exhibit number 56?
This is the back of the jeans that Mr. Woodward was wearing, and there are no defects.
All right. And is that the area around the seat of those pants in the center there, is that blood in that area?
That is blood, that is correct.
And also, doctor, in addition to the pants, did you check the sweater to see if there was any obvious mud on the sweater as well?
Yes, I did.
And was there any obvious mud on the sweater?
No, there was not.
All right. We can turn off the screen now. Thank you. So, doctor, when you started your examination of Alex, as part of your examination, do you attempt to get an approximate height and weight of an individual?
Yes.
And were you able, what did you note? And actually, let's do something else first.
Yes,
May I approach? Dr. Mills, I have handed you what has been marked for identification as exhibit number 3. Can you tell me what exhibit 3 is?
It is a copy of my autopsy report that I generated for the death of Mr. Woodworth.
All right, and is this the copy of the final autopsy protocol?
Yes, it is.
All right, and does this document contain a summary of the findings that you made as it relates to your determination as to the cause and manner of the death of Alexander Woodworth on or about March 22nd of 2018?
It should be March 24th.
Okay, well, that's when you did your autopsy.
That's when I did the autopsy. Yes.
So the death occurred on or about March 22nd. Your autopsy was on March 24th?
My autopsy was on March 24th, correct?
Okay. And does this contain a summary of those findings?
Yes.
All right, Your Honor, I'd move the admission of Exhibit 3 at this point in time.
Any objection to Exhibit 3?
No.
Exhibit 3 will be received, ladies and gentlemen.
So, Doctor, getting back then to height, were you able to obtain an approximate height for Alexander Woodworth as of the time of your autopsy?
Yes, I was.
And what was his height as of the time of your autopsy?
5'8".
All right. And did you also obtain an approximate weight of Alex at the time of your autopsy?
Yes, I did.
And what was that approximate weight?
137 pounds.
Now, let's start then talking about your actual autopsy and your findings. You start with your external exam, I believe is what you said, correct?
Correct.
All right. And one of the first things that you typically check, would that be the nose and mouth area?
Yes.
All right. And what did you note as it related to the nose and mouth areas of Mr. Woodworth? And if you need to refer to your autopsy protocol, that's fine. That's why we admitted it.
I didn't recall anything, and I just confirmed that I don't recall anything.
So nothing, no issues with that? No
That is
injuries,
correct.
no, all right. Now, as part of your procedure and as part of what you did in this case, did you prepare what would be known as a PowerPoint presentation that will help to demonstrate your various findings from your autopsy?
Yes.
All right. Can we switch back to the screen again in a moment here? And does this appear to be the PowerPoint that you prepared?
Yes.
All right. And Doctor, what you have up there is a laser pointer, also is a remote for the computer, and will allow you to cycle through the slides. The top button, which has an up arrow, will move you forward. The bottom button will move you back one. Okay? All right. So right now we just have a title slide. Why don't we move to slide number 2? Should. All right. Well, I'll move it for you. All right. There we go. What are we seeing in slide number 2 let's start with, slide number 2 here. What are we seeing?
You are seeing Mr. Woodworth as how he arrived to my facility in St. Paul. The body bag is behind him in blue, so he's still lying on that on top of a metal gurney. You see a white sheet. His hands have brown paper bags on them to help preserve potential evidence. There's a multicolored scarf wrapped around his right shoulder and underneath his right forearm and along the right side of his back. You can see the sweater that Mr. Woodworth was wearing. You can also see the jeans and the belt and a little bit of the band of the underwear that Mr. Woodworth was wearing.
All right. And is that the condition that, for example, his pants were in at the time he arrived at autopsy?
Yes.
So in some of the pictures that we looked at earlier, the belt was undone, the top button on the pants was undone. That's not the condition he was in when he arrived?
That is correct.
He was in this condition. It appears can you describe how the belt and the pants are as you saw him initially in autopsy?
They were in a closed position in a normal fitting and wear that a person, male or female, would wear.
All right.
But with the underwear band slightly exposed, though.
All right. And the belt was
Also closed.
okay. Great. Thank you. All right. Let's move to the next slide. What are we looking at here?
We are looking at Mr. Woodworth's hands. The photo on the left is his right hand, and you can see dried blood. And the photo on the left is the unbagged left hand, and you can see a little bit of dried blood on his left hand and a little bit of dirt.
Okay. All right. Let's move to the next slide. What are we looking at here?
We are looking at the bottom of Mr. Woodward's feet that were clothed with the socks. So this is the bottom of the right foot on Mr. Woodworth, the photo on the left. And then the photo on the right is the bottom of the left foot that is socked as well.
All right. And is that the condition that his feet were in at the time he arrived at autopsy?
Yes.
All right. Did any shoes come with him to autopsy?
No.
All right. And obviously then he did not have shoes on when he came to autopsy?
That is correct.
All right. And When you looked at the socks as they sat on Alex's feet, what can you tell us about what you're seeing on those socks?
Well, the right sock, the base of the sock, oops, I'm pressing the wrong button, is clean, dingy from wear, but clean. And you can see where the blood had soaked in but stopped at the back of the heel, but is also along where the great toe is located. On the left foot, you can see that the sock is clean,
Okay.
meaning free of blood.
All right. And any mud on those socks?
No.
Let's move to the next slide. What are we taking a look at and what do we see here?
This is a sharp force injury. When I document sharp force injuries, I systematically just name them from one or number them from one throughout front to back. So I start at the head, go to the feet and the extremities. So this is what I've labeled as sharp force injury number 1, and it's above his right ear. And you can see there's a linear defect, which is a sharp force injury with clean edges.
All right. Let me stop for a second. I want to ask a couple questions. First off, when you say a sharp force injury, what are you talking about?
An injury caused by an instrument with sharp edges like a knife.
Okay. And you say you number them. Are you able to, and can you, as part of an autopsy procedure, generally determine in what order injuries occur?
You have some idea potentially of an order in some cases, but you systematically just start numbering them from how you see them as what it would make sense when you're looking at an individual.
All right. And so you start at the head, the front part of the body and the head, and move down to the toes, basically,
Correct.
and then reverse and do the same thing with the back?
That is correct.
All right. So the highest injury would be number 1, and then the lowest injury on the back would be whatever the last number is that you total up.
That is correct.
Okay, great. Thank you. All right, then let's move on to the next slide. What are we seeing in this slide? Slide number, for the record, slide number 6.
What you are seeing is the unroofing of the calvarium or the top of the skull. The photo on the right, you can see the saw marks. On the photo on the right, this is a reflected scalp, so that we're looking at what's called the subgaleal tissue. So here is hemorrhage or subgaleal hemorrhage on that right side. Now, if you go to the photo on the left, this top part or the calvarium of the skull has been pulled down to reveal the dura here. And to the right of that, you can see a brain. There is a collection of blood called subdural blood here in the blue gloves of my assistant. And then you can see the edge of the skull as well there. And on the photo on the right, you can see that there's a sharp force defect right above the right ear.
All right, so let's just talk about this a little bit. First off, you use the term subgaleal blood. What is subgaleal blood?
That is the blood that is on the reflected surface of the scalp.
All right, so we're underneath the scalp, but above the skull, okay? And then you talked about subdural blood, and I think you have the term subdural hemorrhage there. What is subdural hemorrhage?
So this is the dura. That is this kind of tent-like structure that you're seeing in the photo on the left. This space that's clean, that's called the epidural space. There's no blood there. Underneath the dura, or sub, meaning like subterranean, below, there's a collection of blood, and you can see it starting here, and it's pouring out into the glove of my assistant.
All right, and is that below the skull itself?
Yes.
All right, so is that in the area that would correspond to where that, what you call the sharp force defect in the skull would be?
Yes, that's correct.
All right. Does that what does that tell you about what happened with the knife or whatever instrument was used to cause that sharp force injury?
That vessels in the subdural and between the dura and the brain have been ruptured, and that causes the hemorrhage.
All right, and that was by the knife or whatever other instrument went through the skull into that area?
Well, the subdural, yes, that would be correct, that there's hemorrhage there from the injury from the knife as well.
And how deep did that injury go from the into the subdural space or the subdural area?
It was a tract of 1 inch.
So 1 inch deep?
That is correct.
All right. And how hard is the skull to penetrate with a knife or some other type of sharp force instrument?
It takes a lot more effort and difficulty to penetrate the skull than it would soft tissue.
I assume we don't have people going out and testing to see how much force is needed to go through people's skulls typically
We don't, but I did come across a research paper.
on that area?
Yes, of a case report, yes.
All right. And, okay. Did besides the subdural and the subgaleal hemorrhage, was there any additional hemorrhage in that area?
There was, you can't really see it in this photograph because of the subdural is kind of staining the surface, but there's a shiny translucent membrane called the arachnoid mater overlying. Arachnoid, arachnoid, overlying these curves of the brain, and there was blood in that location called subarachnoid hemorrhage.
Okay. All right, let's move to the next set of injuries. Can you tell us what these are and where they are?
This is the front and back on the right side of Mr. Woodworth, and you can see there are 3 distinct sharp force injuries in this cluster. There's 3 tails here at the anterior front of the neck, and there's also 3 tails here at the posterior or back of the neck.
All right. And now, doctor, are these injuries where someone is jabbing the knife into the neck, or are they injuries where someone is slicing across the neck?
It would be a slice.
And there are 3 separate ones?
That is correct.
And why do you say that?
Because of the 3 distinct tails, both at the front of the neck and at the back of the neck.
All right. And are you able to determine, and can you determine in which direction the slice is going? In other words, is it slicing from right to left, left to right?
The direction of the wound tract is going back to front, right to left, and slightly downward.
Okay. Thank you. And doctor, it appears that there's quite a bit of separation there of the skin from those injuries. Can you explain why that happens and how that happens?
The elastic fibers that is in everyone's skin and in the region of this neck have been completely transected, so it opens up a wound so that you can expose and see the underlying tissue.
And how deep are these injuries to the neck?
The depth is from the surface of the skin to the lowest point where the wound tract ends is 1 inch.
Right. Let's move on then to the next slide. What do we have here?
This is the front left side of Mr. Woodworth, and you can see 3 distinct, what I've labeled sharp force injuries, number 5, 6, 7, and you can also see a little bit of the trail of the sharp force injuries 2 through 4 at the top of the photograph.
All right. And these injuries, where are these on Alex's body?
The front left region of his neck.
All right. And what types of injuries? I understand they're sharp force. Are these slicing injuries, or are these more stabbing type injuries?
These are more consistent with stabbing injuries.
And as far as those injuries, let's start with injury number 5. Can you tell us how deep injury number 5 is?
That is 1 inch deep.
All right. And how about injury number 6?
A ½ inch deep.
And injury number 7?
1 inch deep.
Do they, besides the soft tissue, do they cause any other injury?
No.
All right. Actually, can we go back a second to the previous one? This injury, does that, besides the soft tissue injury, does that cause any other significant injury?
It does. There are vessels lying in this region on the front of the neck. The external jugular vein was transected or severed. The muscle, belly, called the sternocleidomastoid muscle that you can feel. Sternocleidomastoid muscle, which is a muscle you can feel on the front and side of your neck. That was also severed. And then beneath that, a portion of the internal jugular vein was severed.
All right. And can you just tell us about the jugular vein, the external and the internal jugular vein? How large are those veins?
They are classically in the neck and head region. They're the largest veins that you have that are traveling to and from the blood, traveling to and from the neck. So the carotid arteries are the most important arteries going to your head and neck region, and the jugular veins are the ones that drain the blood from your brain and head and return the blood to the circulation to the heart.
And if you sever the jugular vein, the external and the internal jugular vein, is there going to be much bleeding from something like that?
There would be a lot of bleeding from that, yes.
And is that consistent with what you observed on the bleeding or the blood that was found on the sweater and then dropped down onto the pants?
Yes.
All right. Let's move then on to, this is slide number 9. What do we see here?
We are looking at the left side of Mr. Woodworth. You can see his left shoulder here at the right of the photograph. I am indicating 3 more sharp force injuries and an abrasion. Sharp force injury number 8, then 9 towards the back, and 10 in that same plane. And if you look to the right, you can also see 5, 6, and 7 that we've already discussed.
Let's talk about injury number 8. Or I'm sorry, yeah, injury number 8. What can you tell us about injury number 8?
That particular sharp force injury penetrated the underlying soft tissue, the left chest wall, the rib cage, and then it damaged the left lower lobe of the lung. And the diaphragm is a muscle that separates the thorax from the abdomen. It also damaged that as well.
Right. And how deep was that particular injury? Number 8.
This injury right here was 3 3/8 inches deep.
And you say it penetrated the lung. What can you tell us about what you observed with the? Did you eventually open up the body and take a look at the lung?
Yes, I did.
And what could you observe when you did that?
When I opened up the chest cavity, you can see both lungs in their normal places. What you don't see, aside from the defect, is there's no free blood in the chest cavities, which you would expect in a defect to the lung.
All right. And I think we may have a picture of that eventually. Do we, Doctor, do you recall?
Yes, we do.
All right. All right. We'll talk about that a little bit later then. What about sharp force injury number 9? What can you tell us about that?
This particular sharp force injury damaged just the underlying subcutaneous or fat tissue and muscle tissue on the left side of the left lateral torso, and that's it.
And approximately how deep was that injury number 9?
That was 1 inch deep.
All right. And then going to injury number 10, what can you tell us about that injury?
This also just penetrated the underlying soft tissues, did not enter the rib cage either, and it is 1 inch deep.
All right. And then you have...
Excuse me, 1.5 inch deep. Correct that.
Great, thank you. And then we have what you list as an abrasion. What is an abrasion?
An abrasion is scraping off of the skin. So when you fall and get a skin scrape, that's an abrasion.
All right.
So layers of the skin are actually kind of in direct contact and have come off because of an object.
And is that more typically like a friction type injury?
That is correct.
All right. Let's move then to slide number 10. What are we seeing on slide number 10?
This is the back left side of the sweater that Mr. Woodworth was wearing, and I have demarcated in the slide that they correspond to what we saw to his torso. So sharp force injury 8, 9, and 10.
All right. And those go through in the locations where if that sweater was worn in the normal position, the injuries that you observed on the body would have been?
Correct.
All right. And let's move to what would be slide 11. And what are we looking at in slide 11?
This shows the internal damage of wound sharp force injury number 8. And here we've got on the left side the defects to the left lung, which is also in the middle of the photograph as well. A defect here that's showing fat coming through. This big belly is actually the diaphragm. And then on the photo on the right is now the diaphragm without the fat in it, and you can actually see the demarcated defect.
All right. And doctor, what are we seeing here that's significant in your mind as it relates to sharp force injury number 8 and penetration of the lung?
Well, you can see that there's a little bit of bleeding, but again, the lack of bleeding in the chest cavity was significant.
And what does that mean to you?
That after sustaining this wound, Mr. Woodworth did not live very long.
And when you say not very long, I assume, can you give us a estimate on how long that would have been?
It would be very difficult to say, but it's not just pure minutes. It'd be longer than that, but you can't really say.
Okay. If he had lived significantly longer after that, what would you see there?
You would see a lot more of hemorrhage around these wounds, but you'd see blood pooling like you did the subdural blood. You can feel the blood, and as you saw in the hands that I had in that PowerPoint, you'd have a pool of coagulated blood or free blood, fresh blood, in that chest cavity, which Mr. Woodworth did not have.
Right. And why don't you see that type of bleeding after an individual is dead?
Because that means that they died a short time after acquiring that wound.
And so if you stab into an area, does it have an effect on, does the amount of bleeding depend on whether or not the heart is beating?
It does depend on that, yes.
And why is that?
Because the blood is the motor house of the body, pushing the blood through the circulatory channels, the blood vessels. So if the heart is taken out where it's not pumping, the blood stays where it's located.
All right. And so you don't get hemorrhage?
You can get some, but you don't get the pushing of like force from more blood coming into the area.
All right. So more like what you see here versus what you saw in the subdural space.
That would be correct, yes.
All right. Let's move on then to what would be slide number 12. What are we looking at here?
This is the front lower abdomen or suprapubic region of the abdomen of Mr. Woodworth here at the left side, showing sharp force injury number 11. And then we are looking at the scrotal sac of Mr. Woodworth and what I've labeled as sharp force injury number 12.
All right. Let's start with sharp force injury number 11. What can you tell us about that?
That particular sharp force injury damaged the underlying abdominal fat, but it also went down into the bladder.
All right. And approximately how deep was that injury?
That was 3 inches deep.
All right. And what can you tell us about sharp force injury number 12?
This particular injury is had struck a highly vascularized area, so there's a lot of internal bleeding or bruising, and you can also see the bruising, the purple discoloration. Most of it's been blacked out to preserve the genitalia, but you can see a little bit of bruising here and as well as there on the other side of the grayscale.
And what does that tell you then about this particular injury as far as the timing of that, or what is that going to be an injury when the heart was still? I'm asking a bad question. Let me start over. Is that injury one that you would label as perimortem?
No.
All right. The other injuries that we talked about, the ones to the lungs, are those injuries that you would label as perimortem?
You could label them that, yes.
All right. And what does perimortem mean?
That is in the, you acquire a wound or injury around the time that you're in the dying process.
All right. Well, let's move on to the next exhibit. What are we looking at here, or the next page of this slideshow, which is slide 13? What are we looking at here?
We are looking at, on the left side, the front and crotch region of the jeans that Mr. Woodworth were wearing that correspond to sharp force 12, which was in the scrotum. And then we are looking on the two photos on the right, the underwear that Mr. Woodworth was wearing. The top one showing the defect into the band of the underwear that corresponds to the suprapubic sharp force injury number 11 that got the bladder. And then the one on the lower right is again the front crotch region of the underwear that corresponds to sharp force injury number 12.
And what does that tell you about how Mr. Woodworth's clothing was at the time that he sustained these two injuries?
He was wearing them in the normal fashion.
Similar to how you saw them when he came into autopsy.
That is correct.
All right. Let's move to slide 14. What are we looking at here?
This is the internal aspect of the wound tracks 11 and 12. The photo on the left is showing the sharp force injury through the abdominal region just over the bladder dome. And the one on the right is showing now what I've opened up, the scrotal sac, and you can see the internal hemorrhaging that's abundant.
And what are we seeing as far as the amount of hemorrhage as it relates to sharp force injury number 11?
In number 11, fat has this yellow look to it over here. This orangey red is from our cuts as we perform the autopsy, but this more intense red or purple, that is actual hemorrhage that corresponds to the wound tract.
And was, as far as this injury, can you tell us whether or not this one would be perimortem or would it be earlier than that?
You would put it in a time scale of earlier than the process of dying, but.
Okay. All right, let's move on to exhibit or page number 15 of the slideshow. What are we seeing here?
This is sharp force injury number 13 on the right index finger. So Mr. Woodworth's thumb is down here at the lower right corner of the photograph. This would be the lateral region of the right index finger. You can see the sharp force injury. That's sort of V-shaped here.
Right. And would you be able to characterize what type of an injury we're looking at here?
This would be described as an incised wound or a cut.
Right. Moving to exhibit or page number 16 of the slideshow, what are we looking at here?
On the photograph on the left, this is showing the front of the right thigh, and that is showing the sharp force injury that I have labeled as number 14. You can see hemorrhage in the underlying fat or adipose tissue there. And on the photograph on the right, it's Mr. Woodworth's jeans again. And I've demarcated where the defect on the front right thigh of the leg of the pant that corresponds to the sharp force injury on his right thigh.
And as far as sharp force injury number 14, what could you tell us about that?
It just damaged the underlying soft tissues only.
And approximately how deep was sharp force injury number 14?
7/8 inch.
And again, the pants would have been in their normal position when that injury was sustained based upon what you observed?
That is correct, yes.
Let's move to slide number 17. What do we see here?
We are looking at the back of the right shoulder of Mr. Woodworth, and you can see a defect I've labeled as sharp force injury number 15 at the top back of the right shoulder. And then towards the left side of the photo, you can see another defect that I've labeled as sharp force injury number 16.
All right.
What I haven't labeled is the sharp force injuries 2 through 4 that you can still see on the right posterior.
And what can you tell us about sharp force injury number 15?
Sharp force injury number 15 went through the underlying soft tissue in the shoulder, and that was it.
All right. Approximately how deep was that one?
1.5 inches.
All right. And then sharp force injury number 16, what can you tell us about that one?
This particular sharp force injury went through the soft tissue of the back, but also went through the posterior chest wall or rib cage, and it then damaged the right lower lobe of the lung.
So is this the opposite lung of the other one?
That is correct.
Right. And approximately how deep was that injury?
2 3/4 inches.
All right. And I think we'll get to some internals of that in just a moment, but let's talk about image number 18, slide 18. What are we seeing here?
You are seeing the back of the sweater that Mr. Woodworth was wearing and the two defects on the back right. The top one is labeled sharp force injury 15 because that corresponds to the top of the right shoulder that we just saw on Mr. Woodworth. And then another one indicating the defect that corresponds to sharp force injury 16 on the right side of Mr. Woodworth's back.
All right. And again, those correspond as if that sweater was in the normal position at the time that those injuries were sustained.
That is correct.
Right. And then slide number 19, just two more to go, this one and the next one. What are we looking at here?
This is the inside of the right posterior chest wall. You can see the defect that I label as sharp force injury number 16. And you can see a little bit of surrounding hemorrhage of the intercostal muscle there on that photo on the left. And on the photo on the right, this is the defect to the right lower lobe of the lung.
All right. And doctor, what does this tell you as far as these injuries and whether or not these injuries could be considered to be perimortem or not?
They could be.
And why do you say that?
Because we have just a little bit of hemorrhage here in the intercostal muscles as well as a little bit of hemorrhage surrounding the defect in the right lung.
All right. And if these are made much earlier than perimortem, what would you see as far as hemorrhage relating to these types of injuries?
Well, if you look at the photograph on the left side here, we are looking into the body cavity. Mr. Woodward's head would be up towards the ceiling. His feet would be down towards the floor. His spinal column is right where this edge of the photo that I've kind of cropped, and the edge of his rib cage is on the kind of left side of this photograph as well. If he had lived for a period of time, blood would have filled this cavity that I kind of talked about before with the left lung. That's where the blood pools. There was no blood there.
All right. And doctor, do you have an opinion as to whether or not it is likely that sharp force injury number 16 and the other injury to the lung, which I believe was sharp force injury number 8, were at approximately the same time?
They're approximately the same time.
And why is that?
Because again, of the lack of the bleeding inside the chest, the free blood in these chest cavities, there isn't any. So there's not a significant survival period.
I'm sorry, I didn't hear the question. The question was whether these occurred at the same time as...
At approximately the same time. 16 and 8.
Got you.
Okay, thank you. All right, then finally, what we're looking at here, what are we seeing?
This is a collage of 4 different photographs. The top left one is Mr. Woodworth on his back, and we're looking from the right side of his body. You can see what I've labeled as an abrasion, but again, you can still see sharp force injuries 2 through 4, a little bit of sharp force injury 15, sharp force injury 16, and sharp force injury 14.
All right, and the next one over with the hands.
This is the top right photograph is showing 2 abrasions on the back of the left index finger and left middle finger.
And the one in the bottom right?
The bottom right is showing a small abrasion on the palmar aspect of the right wrist.
That's the palm side?
That's correct.
All right, and the bottom left?
Bottom left is showing an abrasion. There is a faint hint of a contusion around that as well on Mr. Woodworth's left knee.
And when you say a contusion, what are you talking about?
That is a bruise.
All right. Doctor, just a couple things to back up a second. We can turn off the projector now. The sharp force injury to the head, what was the direction of were you able to establish a wound track or a direction for that injury?
Yes, I was.
And what was the direction of that particular injury?
That was going front to back, right to left, and slightly downward.
All right. And how about the injury to the scrotum or the scrotal sac? Was there a directionality to that one as well?
There's no real directional component. You can just say front to back because it was the front surface that was struck, and so the damage occurred posterior to that surface. No other directional quality to the scrotal sac.
Okay. When you received, when Alex Woodworth's body came to your autopsy room, can you tell us the condition of you talked about the bag, that it was in a body bag. What was the condition of that body bag when it arrived?
It was sealed.
All right. And did you break the seal?
I did.
All right. Of the injuries, and correct, and I guess I just want to be sure that I understand for sure, perimortem. Where is what again does that mean? Just so that I understand it for sure.
Perimortem is around the time period of the process of dying. So antemortem is prior to death. Perimortem is in that process of dying, and then postmortem is after death.
All right. And which of the injuries, in your opinion, would be perimortem of the injuries that you observed?
I would say 5, 6, 7, just because of lack of significant hemorrhage that I could see in the adipose tissue, potentially. The ones to the torso, although to be fair, you do need to see more of an internal wound track, so wound 8, but that would include 9 and 10. 11 could be considered, that's the suprapubic one that damaged the bladder. There was only minimal hemorrhage. We didn't have free blood in the pelvis region. Wound number 13 is hard to say because usually a superficial incised wound like a paper cut, you don't get a significant amount of bleeding, so I'm going to leave that wound out. But number 14 to the right thigh could be considered perimortem. I didn't see a lot of significant bleeding there either. Wound number 15 and wound number 16, the two that we just saw on the right back.
All right. And so then that leaves us, of the ones that you would say are definitively not perimortem, would all of those be antemortem? Let's leave out number 13 for now, which is the one you said, just because of the amount or the size there, you can't say for sure. But would the other ones be antemortem?
That would be correct, yes.
All right. When someone is in that perimortem state, when they're getting to that point, is there an effect typically on the body at that point in time?
There is, but it depends on the cause that got you to that perimortem state. Oh, go ahead, I'm sorry.
No, continue, I'm sorry.
In this particular instance with the sharp force injuries and losing of blood from the injuries, there would be cardiovascular collapse because you're losing a lot of blood. So your heart is trying to keep the individual, in this case, Mr. Woodworth, alive and would shunt the blood to the brain and the lungs and the heart at the peril of the skin, the kidneys, the spleen, the liver. You're trying to keep the greater being alive and sacrificing some of the other organs to do so.
And as it's doing that, it's going up to as I understand it, it goes up to the brain through the jugular or through the carotid artery, and then it's coming back through the jugular veins, correct?
That is correct.
And is that speeding up then the blood loss because of the fact that those are then severed?
Well, the head consumes quite a bit of the output of the heart, so it's considered a significant wound when you have any injury to the neck the major neck vessels.
All right. Now, after you finished the external exam that we've talked about, you then conducted your internal exam?
That is correct.
And what's the process of doing an internal exam? What's the first thing that you do?
First, you check that the organs are in their normal anatomic locations. Some people are born with some congenital issues where there's transposition or different sides. So when your heart's supposed to be on the left side, it's actually on the right side. So you're looking for that kind of anomaly in general. And then you also start looking for natural disease processes.
All right. And were all of Alex's internal organs in their normal anatomical position?
Yes, they were.
And I assume you take a look at the heart.
Yes,
And what can you tell us about your internal exam of Alex's heart?
it was normal.
All right. Anything about the heart or anything in the cardiovascular system besides the injuries that you described to, for example, the jugular veins, anything about the cardiovascular system that would have led to or been a cause of Alex's death?
No,
Do you also look at the gastrointestinal system?
yes.
All right, and what can you tell us and tell the jury, explain to the jury what the gastrointestinal system is?
That is the digestive tract. So that is formed by the esophagus, the stomach, the small bowel, and the large bowel.
Anything about that was of concern in your autopsy?
No,
Anything about the gastrointestinal or the GI system that would lead to or be a cause of Alex Woodworth's death?
no,
Did you review the other internal organs?
I reviewed all of them, the liver, the spleen, the kidneys, the bladder, the prostate gland.
And any of those, you've already described the injuries to the lungs, and you've described the injury to the bladder that were sharp force injuries. Anything besides those sharp force injuries to those particular internal organs that had a role or in the cause of the death of Alex Woodworth?
No,
Did you note any disease or other process besides the sharp force injuries that contributed to Alex Woodworth's death?
no,
Now, do you also have toxicology performed on some of the samples from Alex Woodworth?
yes.
All right. And can you tell us briefly what toxicology is?
Toxicology, that is testing for both prescribed drugs as well as illicit drugs.
All right. And what do you generally have tested for that?
In this particular case, it was a large panel of drugs as well as alcohol.
All right. And do you test, I think you talked about, and maybe that was a poorly worded question, do you test blood, urine, vitreous fluids, or all of them?
It depends on the case.
Okay. And in this case, what did you have tested?
I tested the blood.
All right. And when you had that blood tested, you send it out, I assume, to a lab?
That is correct.
And is it a lab that you generally rely upon as part of your duties as a forensic pathologist?
Yes, it is.
And was anything noted from that was contributory to the death of Alex Woodworth?
No,
Were you able to, and did the tests indicate the presence of any types of drugs?
just caffeine.
Okay. So something that so coffee or something
or pop
like
soda, Monster energy drink, something.
that. All right. Do you have an opinion, Dr. Mills, as to the cause of the death of Alex Woodworth?
Yes,
And what is that opinion as to the cause of Alex Woodworth's death?
multiple sharp force injuries.
And can you tell us which of those injuries had the greatest impact on his death?
From that of the autopsy, that would be the sharp force injury to the head, so number one. The sharp force injuries 2 through 4 to the right side of Mr. Woodworth's neck. they would have bled profusely. And sharp force injury number 12 to the scrotum, that again bled profusely.
All right. And even though 12 is a pretty small injury, correct?
Yes, in size.
But there was significant bleeding from it?
Yes, there was.
All right. Do you have an opinion as to the manner of death for Alex Woodworth?
Homicide.
And doctor, is one of the things that you, when you conduct or when you have toxicology, is one of the things that is looked for cotinine? What? Cotinine.
Cotinine.
Cotinine, I'm sorry, thank you.
Yes, it is.
And what is cotinine?
It's a metabolite or breakdown product of nicotine.
All right. And can you tell us whether or not there was cotinine shown in any of the tests of Alex's blood?
It was negative.
All right. And following the autopsy, what did you do? What happened with Alex's clothes that you had documented and took the photographs of?
We dried them, air dried them, and then placed them in separate brown paper sacks that were sealed and then secured into a larger brown paper sack and released to the law enforcement.
All right. And that would have been Dunn County law enforcement?
That would be correct.
All right. And doctor, if you smoke a cigarette and then die shortly afterwards, would that necessarily, would cotinine necessarily show in that test result?
Not necessarily.
Okay. Your Honor, at this time I'm going to move as well Exhibit 4. There's two parts to Exhibit 4. One is the actual disc that has the PowerPoint presentation that the jury saw, so that's the electronic version. The other is a printed out version of that PowerPoint. So I'll move those so that the record is complete as to those items, and copies have already been provided to counsel.
Exhibits, was it Exhibit 4A and B, or just?
That would probably be the best way to do it, Your Honor. Have A be the electronic version and B be the printed version.
So they'll be marked, clerk will mark 4A and 4B in that fashion. Any objection, Ms. Vishny?
No.
All right, exhibits 4A and 4B then will be received.
The state has no further questions for Dr. Mills at this point, Your Honor.
All right, well, before cross-examination, we're going to take a break, ladies and gentlemen, so we'll give you 10 to 15 minutes or so you can stretch, use the restroom. Okay, we'll be in recess.
Dr. Mills, you would agree with me, and I believe you said it on direct examination, that your order of the wounds just has to do with top to bottom, front to back, and has nothing to do with the order that the wounds actually occurred in, correct?
That is correct.
And you might call that an arbitrary numbering system, though in fact it seems to be quite logical, doesn't it?
Yes.
And you would agree that you cannot exactly order these wounds. I mean, you've made some comments of ante-mortem versus peri-mortem, but you can't say first was this one, then was that one, then was that one. That's not something that a person can do, right?
That's correct.
Okay. And you would also agree, I'm sure, that when something is happening, it's a dynamic struggle when this stabbing was occurring, that you cannot say this person, the person being stabbed, was laying down or face up. You can't say that unless you have a videotape running to show what actually happened, right?
You need something that shows you for both, not only the victim, but the assailant as well.
And thank you, because I was going to mention that. That was actually going to be the next question, so you took the words right out of my mouth. So you also would need to see the two people, the person with the knife, the other person in motion with each other, to know exactly what happened, right?
To get a better idea of what happened.
Correct. So let me ask you specifically about the clothing. You took a look at the clothing that came in with Mr. Woodworth's body into the morgue.
That is correct.
And so you were able to see the clothes that he was wearing, but obviously not the clothes he wasn't wearing, correct?
That would be correct.
So you didn't examine his coat, right?
That would be correct.
Didn't examine his shoes.
That would be correct.
Because you were told that those items were not on his body when his body was found.
That would be correct.
And the one thing that you did note, or well, you noted a lot of things, but something you did note was that the socks and the pants did not have any mud on them.
Correct.
So certainly he wasn't kneeling in the mud because we would see mud on his pants, right?
Correct.
And he wasn't walking around outside in his socks because there were no mud on his socks.
That is correct.
They were dirty, but that's more of a laundry issue, right?
Correct.
Okay, can we turn that on, please? Okay, and I'm just showing you what's been marked as exhibit number 603, I believe. That is a photograph from the scene, correct?
Yes.
You've seen that before because at a different time, either law enforcement officers or prosecutors showed you seen photographs, even though we haven't discussed those yet.
I have visualized seen photographs. I don't know that I recognize this one.
Okay, but one thing that you are able to do or tell us from looking at that is you can see there's blood on the ground.
I agree, yes.
And blood, when blood drips, it moves in the direction of gravity. That's purely logical, right?
That is correct.
Right, so if I'm standing like I'm standing right now and bleeding, it's generally gonna go down.
That is correct, yes.
And if I'm standing on my head and bleeding, it's gonna go in the direction of my head, let's say if I'm bleeding from my neck, right?
Can you repeat that again?
If I'm upside down, it's gonna go the other way. That's basically
Yes, that is correct.
fancy way of saying that. All right. And it is also true that blood gets absorbed by clothing, right?
Yes, it does.
Okay. Now, we talked about the issue, we can take that picture off. That's fine, Madam Clerk, thank you. You've talked about what perimortem is, and there was a lot of time spent on this, and I wrote down, you said that perimortem is around the time that a body is processing death. I believe you used that word.
It's the process of dying.
It's the process of dying, which doesn't happen necessarily in an instant.
That is correct.
I mean, it can. If you shoot somebody in the head, they could potentially die in an instant, right?
There are possibilities of instantaneous death.
Right. But in this particular case, as far as perimortem, when you talk about perimortem, you cannot say how long it is. What you can say is it's longer than pure minutes. That's where the words that you used.
That would be correct, yes.
Okay. So there's no real way to tell exactly what it is, right?
Correct.
But what you do know from having looked at these injuries is that after Mr. Woodworth, let's just talk about the neck injury for a minute, okay? You showed us the neck injury, which is basically 3 injuries, number 2 through 4.
Okay.
Right?
Well, there were 6 then. 6
Well, all
injuries
right,
to his
I'm
neck.
sorry. I should be more specific. The one that's kind of gaping on the right side of the neck are injuries number 2 through 4.
That is correct.
All right. And the reason that gapes, as you pointed out, is because the elasticity of the neck, the skin stretches out. It's not like somebody took a knife and took a big chunk out of someone. It's a slash mark.
It's a slash through the elastic fibers.
Okay. And just as we talked about before, you can't tell exactly what's happening without knowing how people are moving. It's impossible to tell exactly what was going on with these 2 bodies at the time of that slash mark.
That is correct.
And in fact, it's quite possible that the knife in the hand of the person who's wielding the knife may not even necessarily leave the skin when when injuries number 2 through 4 happen.
There is potential that, yes, the knife did not leave the skin surface and kept cutting in different directions.
And that could be because either the person who's being cut is moving or the person doing the cutting is moving.
That is correct.
Either one.
Correct.
So certainly the person who has the knife and has made that mark may not perceive at all that it ended up being 3 separate wounds.
That is possible.
Right, it's certainly possible they could perceive it as one particular wound, right?
That's possible.
And we talked about the fact, or you talked about the fact that a lot of the wounds in this case are pretty shallow, relatively speaking.
Except a few.
Except a few. Few of them are deeper,
That's
right?
correct.
But most of the wounds are somewhere between 3/4 of an inch to 1.5 inches, right?
That is correct.
And most of the wounds simply hit soft tissue,
Correct.
and most of the wounds, except for the wound to the head, didn't particularly cut through bone, right?
The sharp force injury number 8 did go through bone.
Okay, and that would be the sharp force injury to the lung.
Yep, the left lung, the left chest
The left
cavity.
lung. Okay, but otherwise, the rest of these wounds go not particularly into hard surfaces like a skull or a bone, which require more force, correct?
That would be correct.
And it doesn't, and how much force something requires, you can't really tell, right? Because like you said, you can't measure it, correctly?
That is true and false. There
Okay.
are records of force necessary.
Okay, so, but in terms of actually what's happening, like when you go through skin, actually what I mean to ask you is this. When a knife goes into a body, into a soft tissue area of a body, the tissues collapse, right? Or can collapse, why don't I say that? Be more precise.
It is possible that they collapse, yes.
Right. So for example, one can have a wound that is longer than the length of the blade of a knife that went into the body.
That would be an incised wound, yes.
And that particularly tends to happen in soft tissue, correct?
Yes,
And therefore, we see that more in the torso or the abdomen, which is softer than, let's say, you cut into somebody's arm and it hits bone right away.
well,
Stab into somebody's arm.
oh, I was gonna say, any part with skin, you can have an incised wound, so that would be an incorrect statement, but you're
Okay.
more likely to hit bone in certain locations.
Okay, so this tissue collapse, so the length of a knife wound does not necessarily match exactly how deep a knife went in. It varies, it can vary.
It can vary, correct.
Okay, now, you talked specifically about wound number 11 being very, I can't remember if you said it hit the bladder, it was very close to the bladder?
It went through the bladder.
Okay, so that would cause the person who received that wound to potentially feel an urge to urinate.
The only nerve fibers you feel are on the skin surface, so every sharp force injury would cause pain. A sharp force injury to the bladder would not cause pain because there's no nerve fibers for that, only for the expansion of the buildup of urine.
Okay, but it could potentially cause that person to feel that they needed to urinate, right?
If there's pressure on the bladder from an external force, yes.
Okay, and in terms of Mr. Woodworth, one of the other things you mentioned was wound number 13. That was a small wound to the, I think it was the right index finger.
That is correct.
And that is what one might call a defensive wound.
You can put it in the textbooks, they would say anything on the upper extremities or possibly lower extremities would be considered a defensive wound.
Okay, so on the upper extremities, that would be the hands, for example.
That would be correct.
So one would call something like a defensive wound if it's in the palm of a hand. That can be considered, or that's classically a defensive wound.
On any surface of the extremities, yes.
Okay. And by the way, in terms of looking at this, you did notice some abrasions in addition to the sharp force injuries.
That is correct.
One of those abrasions was to the knee,
That is correct.
and I believe that was to the left knee.
Yes.
Correct? And there was no mud around that abrasion,
Correct.
and no mud on the pants outside that corresponded to the abrasion on the left knee.
Correct.
No cuts to the pants to the abrasion on the left knee.
Correct.
And the abrasions that you saw, well, I wouldn't use the word contemporaneous, but they happened around the same time as this entire knife struggle, correct?
Yes.
Now, certainly, Mr. Woodworth's larynx was not cut,
That is correct.
so he could talk,
That is possible.
right? And he could not only just talk before he died for some time, he could walk. correct?
That would be correct.
And the lungs never collapsed.
That is correct.
So there's not lung collapse. There was nothing what you would call a pneumothorax, meaning air in the lungs, right?
Meaning air in the chest cavity, that free space that we saw.
Right. And although eventually his voice could get weaker, at a certain point he could still talk, right?
That is correct.
Like that knife wounds, the knife wounds you saw to the neck would not impede talking.
That would be correct.
And the knife wound to the head, which you've talked about, would also not impede talking.
That would be correct.
And it would not impede walking or voluntary movement either.
That is correct.
So in the time that he lived, he could potentially be walking and talking. There's nothing medically that says that could not have happened.
Correct.
Okay. All right, I just want to ask you, you talked a little bit about your training, and if I remember correctly, you've really gone through a lot of training to get to the position that you're in today, right?
Yes.
It's fair to say medical school, residencies, and then you've had 2 actual fellowships. That's a long period of time to be in training.
Well, the sub-fellowship was during my last year of residency as well, so it was at the same exact time.
Okay, I understand. So that's the sub-fellowship, and that's the one in anatomical pathology, right?
Well, residency is anatomical pathology,
Okay.
but the hospital that I trained at was also very close to the medical examiner's office, and I was granted permission to do both at the same time. And then I did my formal forensic pathology training after I completed anatomic pathology.
Okay, and that's when you're a forensic fellow.
That is correct.
Okay, and that's generally speaking, a period of a year where you're a full doctor, but you study under other doctors, right?
That is correct.
And they, the chief medical examiner will look at your work and evaluate it and discuss it, and that's how you get better at what you do.
That's how you learned what you're
Yes.
doing, yes.
Okay, so as I understand it, in terms of that, it's different than the kind of training you've received as a forensic pathology is much more extensive, let's say, than somebody who's doing a residency in a different field of medicine and just goes through a rotation in forensic pathology.
That is correct.
Okay, a rotation is just a matter of what, several weeks?
It can depend, it could be 1 or 2 months.
Okay, but it's not the extensive training that you've gone through the entire year with the fellowship and getting board certified.
Well, forensic pathology, I mean, you learn, other doctors in other fields will come through and shadow or go through rotation with the medical examiner's office so they can learn injuries as well. However, their job is not to do what I do, doing a postmortem exam, doing the autopsy, signing a death certificate for cause and manner of death in that particular case. They may utilize those skills in whatever field they do.
Correct. And it doesn't, and of course, when you're board certified, at a certain point, you have to reboard, don't you? Don't you have to take the exams again at a later date?
It depends on when you graduated.
Oh, okay. So are you one of the lucky ones who doesn't have to take it, or one of the unlucky ones who does have to do it again?
I do not have to take it again.
Okay. And as far as, one other question about the body, you did not note in your reports any hilt marks from the knife in Alex Woodworth's body, correct?
That is correct.
Now, by a hilt, a knife has a blade, and then the edge is usually what you call the hilt to the handle. Is that?
That is correct.
Okay, I'm not real hyper technical, but so when somebody plunges a knife fully into another person with great force, it can leave a hilt mark on the body.
It's possible. It depends on what the victim is wearing.
Okay, so it might not happen through clothing, correct?
That is correct.
All right, and actually, in most knife wounds, you don't actually even see hilt wounds, right?
That is correct.
Okay. Now, in addition to your board certification and your job, you've also published some articles, correct?
That is correct.
And I'm looking at exhibit number 2, which is your curriculum vitae. You've shown what you've done some research on, right?
That is correct.
And in this, and you've also had, I believe, and I counted them, you can tell me if I'm wrong, but I counted 7 published articles in various medical or scientific journals.
I believe there's a few more that have yet to be added.
Okay, but 7 on the copy of exhibit number 2 that you gave me.
Yes.
And those articles are in various areas of infancy, carbon monoxide, various other areas concerning, for various areas of forensic pathology, correct?
No. Some are research things from my residency as well.
Okay,
So that would be anatomic pathology, like breast cancer or kidney cancer, that kind of thing.
all right. But none of them are articles about sharp force injuries.
No, they are not.
I don't have anything further, thank you.
Great. Mr. Dufour, do you have any redirect?
Yes, Your Honor. Doctor, you said, I believe on cross-examination that, I think the question related to, can you tell anything without having a videotape of the incident about the respective positions of the assailant and the victim? And you said it depends. Can you explain to us what that means?
Well, in my mind, when the question was being asked as well, just because if you have videotape doesn't mean it's going to clearly show you any definitive positions of hands, of locations of blows, or anything like that. I've seen enough where you just might not be able to tell things as well.
Okay. And without a video, are you able to tell anything based upon the wounds that you see, especially in something like this where we're dealing with sharp force injuries, about the respective positioning of the assailant and the victim?
What I can say is there's different movements. The trajectories are changing, so bodies are in motion. That's pretty much all I can say.
Okay, that's fair enough. So, Doctor, looking at the blood on the back seat area of the pants that we see here, there were some questions about if the person was standing up, blood is going to move forward. I would assume that if someone's sitting down, blood is also going to move downward, correct?
That is correct.
Is the blood that we see on the seat area of the pants here, can you tell us if that's more consistent with a person that is standing up? Considering the injuries that you observed to Alex, is it more consistent with someone who's seated, someone who is standing, or you can't tell?
Someone who is seated,
Why is that?
because you can see the blood forming kind of a circular pattern in density in the seam, central seam region of the pants. So that would be where the blood's going to pool and start expanding out.
And so if they were standing, you'd see a different pattern there.
You would see a fluid trail going down the leg
All right.
of either side since it was the scrotum.
And you don't see any of that.
No.
Okay, thank you. We can switch that off now. There were some questions about whether some of the wounds were, that many of the wounds were shallow. Would you characterize, I know the one to the head was not very deep, but would you characterize that as a shallow wound or a deeper wound? And if so, why, what's your opinion? Why is that your opinion?
Despite the numerical value of the depth of that wound, the location is important, and that particular sharp force injury that was above the right ear damaged a region of the brain, causing significant bleeding. So the shallowness does not necessarily implicate insignificance.
All right. And would you characterize that as a significant wound?
Yes.
All right. Now, and there were questions about whether or not it is possible that someone can walk and talk for a time period after the injuries. How likely is it that someone can walk and talk for a significant period of time after the injuries that you described as not being perimortem?
Unlikely.
And when you're talking about a significant period of time, what do you understand by that?
Yeah, because the question wasn't significant period of time. The question was, could he do it for a period of time? I just don't want the cross to be misstated.
Well, I'll just sustain. Can you rephrase?
What I was asking, my question was if they could walk or talk for a significant period of time. She said unlikely. Now I'm just trying to ask what a significant period of time is.
All right, we'll go ahead.
Thank you. What in your mind would be a significant period of time?
An hour would be very significant. Even 30 minutes would be significant.
Okay. There were some questions about hilt marks. Can you tell us what a hilt mark is, just so that we're all clear on that?
So the blade of a knife inserts into a handle. At the edge of the handle, between the blade and the handle, there may be, and there doesn't have to be, but there may be a perpendicular structure that helps rest against the hand of the particular user. Kitchen knives don't have a hilt. They're rounded, they don't have hilts. Hunting knives may or may not, depending on your knife. So if you think of like your classic swashbuckling sword, you had a guard and a hilt that covered the hand. Most sharp force knives don't have that really anymore.
Okay. And even if there is a hilt on a knife, if it's through clothing like the sweater or the pants that we see here, would you typically see a hilt injury?
Something more bulky like the sweater would definitely block the impression of a hilt. The jeans shouldn't do it too much because they're a lot thinner fabric.
Okay. Any of the injuries in the pants that would have gone to, if based on what you observed, actually, let me back up a second. Did you have a chance to see a picture of the knife that was involved?
No, I have not.
Okay. Did you see a drawing of it?
Not to my recollection.
Okay. All right, that's fine. You talked about, I think, an incised wound. Can you tell us what an incised wound is?
That is defined as a sharp force injury that's longer than it is deep, but for layman's purposes, it's a cut.
Okay. All right. And were any of the wounds that you observed here incised wounds?
There were some that were complex between a stab and incised. A stab wound is one that is deeper than it is on the surface of the skin. We're always referencing the surface of the skin. That's how we measure the wound. So it's smaller in size, but the wound track goes deeper.
And Doctor, you were asked some questions about wounds to the upper extremities and that some of those can be considered defensive wounds. Do you recall that?
Yes, I do.
Are all wounds to the upper extremities defensive wounds?
No.
All right. And Doctor, have you seen wounds on individuals who have come in for autopsy or through any of your research where an individual suffers a wound to their hand, grabbing the blade portion of a knife to wrest, or in an attempt to wrest that knife away from the assailant?
Yes, I have.
Can you describe what those wounds look like when you've seen them?
They would be deeper. You would start seeing the fat like you did in a lot of the stab wounds, and you may, depending on the depth, see the underlying tendons or muscles of the hand.
Would they be characterized by someone who looks at them as superficial cuts or scratches?
No.
I have no further questions for.
All right, is there any recross?
Very briefly,
Okay.
just a couple of things. You were just asked about, I'm going to be using, we don't have this mark, we need to get that mark. The wounds you've seen, the hands, the deeper wounds that you were just talking about, all the people who you looked at those who came into your lab, they were all dead, right?
That is correct.
Okay, so you haven't, made observations about those kind of defensive wounds in your practice as a forensic pathologist of alive people, right?
All of my patients are dead.
Yes. Okay. And that sounds like a pun or something like that, but anyways, I'm going to show you another exhibit. The item number is what, 6, excuse me for the record, that is going to be number 615. We showed it to you, right?
Yeah.
Very good. So I'm showing you number 615, and that was previously shown. That's Mr. Woodward's body. When you saw it, I think you described something very similar in your packet earlier. The picture is correct?
Correct.
And that picture, which it shows clearly blood on Mr. Woodward's pants, correct?
That is correct.
And we can see the pooled blood in the pants in the scrotal area that you were just talking about earlier that you say could happen while somebody is sitting.
That is
right?
correct.
That could happen also kind of if they're kneeling forward too, as well as sitting, correct?
What we're seeing at the front of the pants, yes, but at the back of the pants, no.
Okay. But certainly on the left leg of the pants, you see what appears to be dripping blood or blood that moved with the force of gravity, correct?
That is correct.
Okay, nothing further, thank you.
Hang on just a second, is that, what exhibit is that?
615.
All right, are you offering that exhibit?
Yes, I'm going to move both of the exhibits into evidence that we have previously used. This is number 615, and I believe the other one that we used was number 603.
Okay, any objection?
Can I just?
603 and 615?
Yeah, no objection to either of those, Your Honor.
Okay, exhibit 603 and 615 will be received. Okay, all right, if there are no further questions, Dr. Mills, you may step down. Thank you.
Thank you.